issue of identification. I think it was mentioned here. We've talked about digital identity as a country. We've started that journey, and this will help us so that we have what we've been calling a single point of truth, so that if you want to identify a person, you identify from one point and it's digitally identified. So we are working with the State Department of Migration and Citizen Services to fast track the deployment and establishment of digital identity. This will now be a platform that is shared nationally, and it will help our people. As we move to digital space and digitize our services, how do we ensure that information security, personal data is kept, personal data is protected and privacy is realized? I think we already have the laws. We have the Office of the Data Protection Commissioner. I think they are at a stand here, and there is clarity on the roles of any data handler. And we want to ensure that every handler complies. If every handler complies with what is required, I think we have ODPC representative to ensure that people comply. Once you comply, we will eliminate that likelihood. We are also joining global bodies that are responsible for data protection and participating both at the continental and global level, so that we quickly update ourselves and align with global aspect, because cybersecurity data protection is not local, it's global also.
The healthcare system in totality, must be planned and must be organized. When it is planned and then organized, digitization becomes a lever. Digitization can also be an enabler, so that then it helps us get efficiencies and it helps us save on both resources and time.
Over 5 million people having enjoyed this service with personal experience. So the journey has just begun, and I think we just need to support. We need to make this system work. It gives us data that was not existing before. You are able to see who served who, what are the issues in the country at an instant. You can give at a weekly, at a monthly. The power it is giving into the hands of decision and policy makers is unimaginable. So the possibilities of transformation in the healthcare and realization of universal healthcare is real. What we need to work is, let's work towards a one system, a national system, that will now serve and realize the universal healthcare.